What is borderline personality disorder, BPD? Borderline personality disorder, BPD, is a complex and often misunderstood mental health condition that affects an individual's emotions, behaviors, and relationships. It is categorized as a personality disorder, meaning it involves long-standing patterns of thought, behavior, and interpersonal functioning that differ significantly from cultural expectations. People with BPD often experience intense and fluctuating emotions, instability in their self-image, and difficulty in forming and maintaining stable relationships. Core features of borderline personality disorder, BPD. At the heart of BPD is emotional dysregulation, which means individuals with the disorder often experience emotions that are intense, overwhelming, and difficult to control. These emotions can change quickly, and people with BPD may go from feeling happy to feeling deeply sad, angry, or empty in a short period. This emotional instability often leads to difficulties in coping with everyday stress and in managing relationships with others. BPD is characterized by several key symptoms. 1. Intense emotional swings. People with BPD can experience extreme mood swings, sometimes lasting for hours or days. They may feel very confident one moment and deeply despairing the next, without any obvious cause for the change. 2. Fear of abandonment. Individuals with BPD often have an intense fear of being abandoned or rejected, which can lead to desperate efforts to avoid being alone. This fear may be triggered by small events, like a friend canceling plans, or by perceived slights, such as not receiving a timely response to a text message. 3. Unstable relationships. People with BPD may have relationships that are marked by intense highs and lows. They may idealize someone one moment, believing they are perfect, only to later devalue them, viewing them as all bad. This pattern, known as splitting, can create a great deal of turmoil in relationships. 4. Distorted self-image. A person with BPD often struggles with their identity and may experience a sense of emptiness or confusion about who they are. They may change their goals, values, or even their appearance in an attempt to establish a stable sense of self. 5. Impulsive and risky behaviors. People with BPD may engage in impulsive activities such as excessive spending, unsafe sex, substance abuse, or reckless driving. These behaviors are often a way of coping with emotional pain or avoiding feelings of emptiness. 6. Self-harm and suicidal thoughts. A significant number of individuals with BPD engage in self-harm, for example, cutting, burning, or have thoughts of suicide as a way to manage their emotional distress or to express feelings that are too difficult to communicate. 7. Chronic feelings of emptiness. Many people with BPD describe feeling empty or hollow inside, as if they are missing something essential. This sense of emptiness may be accompanied by a deep longing or a search for something to fill the void. 8. Difficulty controlling anger. Intense, inappropriate anger is another common symptom. Individuals with BPD may experience rage or frustration that seems disproportionate to the situation, often resulting in verbal outbursts or physical confrontations. 9. Paranoia or dissociation. Under stress, individuals with BPD may become paranoid or experience dissociation, feeling detached from reality or as if they are outside their own body. This can be a response to feeling overwhelmed or unsafe. The causes of borderline personality disorder. The exact cause of BPD is not known, but researchers believe it develops as a result of a combination of genetic, biological, and environmental factors. Some key influences include genetic factors. There may be a hereditary component, as BPD tends to run in families. Individuals with a family member diagnosed with BPD are at higher risk of developing the disorder themselves. Brain functioning. Research has shown that there may be differences in brain structure and function in individuals with BPD, particularly in areas involved in emotion regulation and impulse control. Environmental factors. Traumatic experiences, such as childhood abuse, neglect, or abandonment, are common among those with BPD. These experiences may affect the development of emotional regulation and coping skills, leading to the development of the disorder. Attachment issues. Some experts believe that insecure attachment styles in early childhood, particularly with caregivers, can contribute to the development of BPD. A child who experiences inconsistent care or emotional neglect may struggle to develop a secure sense of self and healthy emotional coping strategies. Diagnosis of borderline personality disorder, BPD. A diagnosis of BPD is typically made by a mental health professional, such as a psychologist or psychiatrist, who conducts a thorough evaluation. This may involve interviews, self-report questionnaires, and assessment of the individual's symptoms. To be diagnosed with BPD, a person must meet specific criteria outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, which includes having at least 5 of the following symptoms: frantic efforts to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships, unstable self-image, impulsivity in at least 2 areas that are potentially self-damaging, recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior, affective instability due to a marked reactivity of mood, chronic feelings of emptiness, inappropriate, intense anger or difficulty controlling anger, transient, stress-related paranoid ideation or severe dissociative symptoms. Treatment for borderline personality disorder, BPD. While BPD is a serious condition, the good news is that it is treatable. Many people with BPD experience significant improvements over time, especially with appropriate treatment. Dialectical behavior therapy, DBT, is one of the most effective treatments for BPD and focuses on teaching skills to manage emotions, reduce self-destructive behaviors, and improve relationships. Other therapies, such as cognitive behavioral therapy, CBT, can help individuals address the underlying thought patterns that contribute to their emotional instability. In some cases, medications may be used to treat co-occurring conditions like depression, anxiety, or mood disorders, though medications are not typically used as a primary treatment for BPD. Conclusion: borderline personality disorder, BPD, is a challenging mental health condition, but with the right treatment and support, individuals can manage their symptoms and lead fulfilling lives. Therapies like DBT, supportive relationships, and commitment to personal growth can provide individuals with the tools they need to regulate emotions, cope with stress, and create stable, meaningful relationships. If you or someone you know is struggling with BPD, it's important to seek professional help. Recovery is possible, and with the right resources, individuals with BPD can develop a healthier sense of self and build a life worth living.